And right on cue, just as I predicted, here we go. The push for vaccine passports begins. Here's CDC Director Robin Walensky. And look, none of this is random, folks. They've been building up to this for a couple of weeks. Walensky explains what it'll take for you to get your freedom back. No more masks. You know what it is? Well, we'll not only have to have full vaccination, we'll have to have proof of full vaccination. And what is that? Vaccine passports. Of course. The only way to look at a whole area and tell everybody's been vaccinated at once. That's exactly what she drives at here. You got to get fully vaccinated and get your passport, or else none of the restrictions come off.
If all kids in a classroom were vaccinated, would there be a need to wear masks?
I can imagine a situation where a school system might have all of their teachers documented and vaccinated, all of their children in a high school documented as vaccinated, and very little disease in the community. Right now, we don't have a lot of situations that are like that, but I could imagine a situation like that, and boy, do I hope we get there, as schools start to open and we have more and more people vaccinated and disease comes down. Right now, we have very few places in the country where that is true.
In case that wasn't entirely clear, she spelled it out. CNN helped. This is, again, what they've been leading up to with their rhetoric of recent weeks.
I know they're doing it in Europe. They're issuing health passes there, right? Where, you can go to a disco if you have a health pass. Is that something that the CDC would ever lean into or perhaps advise here?
That may very well be a path forward.
And that's where all this is leading. The hysterical, over-the-top rhetoric about the Delta variant and the remasking. That's to build resentment, by the way, among the vaccinated, so that when they come out with the vaccine passport, see, why, that'll be a way to resolve the problem. People who are unvaccinated can't go places the vaccinated can, like, to work, to earn a living, or the grocery store to buy food. That's what this is all about, this masking. That's utterly unnecessary, completely unneeded, and the folks recommending it aren't at all afraid of or concerned about COVID. You want to see Exhibit A? This shocking photo. Actually, it's a set of photos taken from C-SPAN. They're stills of Joe Biden less than 24 hours after the mask mandate came out from his administration that vaccinated people should be in masks because of the terror or whatever. And there's Biden at an Allentown, Pennsylvania gathering, surrounded by unmasked people, elbow to elbow with them. I mean, nothing even close to social distancing going on. Wasn't even 24 hours later. Folks, Biden is in the high risk group because of his age. And he's not the slightest bit concerned about catching COVID, but he wants you in a mask. More proof? None of these people are afraid of COVID. That's why the second they think the cameras turn away, they forego the masks. The masks are theater. They're like costumes in a play aimed at achieving an outcome. Total control, or as much as they can seize, of the American people. But these are just some of the strange things going on right now. So far, our elites have simultaneously insisted on two things. The vaccine, totally effective. Not failing at all. Then why do I need a mask? Because you do. Shut up. We're looking at the data. What's going on here? And I normally don't broadcast about things that I don't know what they mean, but this means something. I don't know what it is. This is a local headline out of Phoenix, Fox 10. Here's the headline. Over 25% of new COVID-19 cases in Los Angeles County are fully vaccinated people. That's up from 20% in June. These are the stats July 1st through July 16. A full 26%, or 3,592 cases, are breakthrough, according to Fox 10. They're among fully vaccinated people. Is the shot failing? The creator of the shot, the guy who invented the mRNA shot, has been screaming about this and predicting it for a while. That's why they silenced him. They even banned him off LinkedIn. They were so afraid. He'd tell you what he thinks is happening. And exactly what is that? He said that the way the shot works, people who've had the vaccine would actually be more susceptible to new COVID infection and more likely to spread it. He said it would work fine at first, but would fail soon after. Is that what we're seeing? He also said it would be the bodies of those who've had the vaccine that would become laboratories creating variants, not the bodies of the unvaccinated. That's because the COVID virus doesn't have to do much to successfully infect the body of an unvaccinated person. When it's in the body of a vaccinated person, it undergoes changes. That means mutations. He said that the vaccinated would become veritable factories, not just for COVID, but for variants. I have no idea if that's true. They won't let us debate it. They just silenced him. But the guy invented the vaccine. And here's the weird thing. NBC News basically acknowledged this without mentioning Dr. Robert Malone's name. He's the one who invented the mRNA vaccine, the one who's been predicting this stuff for months. Here's what NBC News correspondent Ken Delanian tweeted yesterday. New data suggests that fully vaccinated individuals are not just contracting COVID, listen to this, but could be carrying higher levels of the virus than previously understood, facilitating spread, my NBC News colleagues are reporting. New indoor masking guidance expected today. Okay, that is exactly what Dr. Robert Malone is saying. They carry more, they breed more, they spread more. The part that NBC News is not acknowledging is the part where they spin off more variants inside their bodies. Look, folks, I don't know. I'm just trying to piece all this together. But here's what's weird. Pfizer just came out and said that, yeah, we can guarantee the shot's good for 6 months. That's it? Well, of course they wouldn't know. It hasn't been around that long. But there are other weird signs that something is up. Like another message dropped by CDC Director Rochelle Walensky this week. You know what she said? The coronavirus could be, quote, just a few mutations away from evading the vaccines. Is the vaccine failing? Is the vaccine actually making things worse? These are now legitimate questions. And honestly, I don't know the answer to them because there's another possibility here. And it's this. The test, the PCR test, is so faulty that it is catching false positives. And the vaccine is revealing it for what it is. And what it is a test that created the perception of vastly more COVID cases than there ever actually were. There's actually pretty good evidence of this in this bombshell story. See, the CDC just recalled the Innova PCR test. It's the main test that's used in this country. It's not the only one, but the others are vastly similar to it. Why'd they recall it? Huge rates of false positives. Now look at how they recalled it, because this is bizarre. They did a class 1 recall on it. That's the most serious recall. That's usually the one that's used for like medical devices that'll kill you. That kind of recall. But they did a weird thing. After they classed it a class 1 recall, they said the recall would not be effective until December 31st, 2021. I.e., they apparently clearly want a test out there that produces massive amounts of false positives. What they're going to replace this test with? They're calling for manufacturers to come up with a test that can differentiate between COVID and the flu. Now, they never said anything about whether Innova could differentiate between COVID and the flu, but you will note that the flu has all but disappeared. The main reason, by the way, that the PCR test, which was approved under emergency use by the FDA, not put through rigorous testing itself to see if it actually returned false positives. The reason it returns 70 to 90% false positive COVID diagnoses is simple. The cycles are set too high for the most part on it. So they're so sensitive, they detect fragments of COVID that never could become COVID. So why stretch it out through December 31st unless you're trying to drive the case for masking and ultimately vaccine passports? Folks, I hate that this podcast is so full of questions today. I'm just laying you out the strange things for you that are happening. I'm trying to decipher a direction for them. What do they mean? Obviously, a lot of this stuff is driving what we're seeing right now from the left. and the leadership in Washington. So is the fear our elites are conveying on television real? Again, look at the evidence. No. Our southern border is shockingly wide open. The news of the last 48 hours is unbelievable. Here's a headline from The Hill. Texas officers said migrants were told they were released because they had COVID-19. Wait, what? Yep, they had tested positive by U.S. Customs and Border Patrol and then released by them because they were positive. In other words, U.S. Customs and Border Patrol is getting rid of the evidence by dumping the COVID positive illegals all over the place. One of the places they're sending them is with Catholic Social Services in La Jolla, Texas, they're putting them up in hotels. Well, this hit the news. There was an illegal immigrant family in the Whataburger, and they were sniffling, sneezing, really looked sick, sneezing on other people. People were so freaked out, they called the police. Police show up, the La Jolla Police Department, and they asked the illegals, hey, what's up? And they're like, oh, we're COVID positive. Yeah, we were released by the Border Patrol because we're COVID positive. So, and they had been tested by the government. So you now have the scandal of the government doing this. You've also got a separate report of cover-ups by our government of COVID outbreaks at our military bases where they're stashing these illegals and using military resources to ship them all over the country. Listen, this is Griff Jenkins.
Meanwhile, at Fort Bliss, where HHS houses migrant children, 2 federal whistleblowers are alleging in a complaint filed yesterday to 4 congressional committees that they were instructed to downplay a COVID outbreak at the facility. HHS is not commenting.
Meanwhile, in La Jolla, Texas, where all the illegals are being shipped to, the ones that have tested positive with COVID that the government then released into the country without so much as a vaccine, the police there outraged. This is from the press conference.
We did not know this. No one told the city of La Jolla, no one told the police department that these people were here. And no one told us that these people were possibly ill.
Now, local authorities are outraged at the federal government. I don't know, what are they planning outbreaks? Assisted outbreaks? Is that what this is? This is from KRGV, another local station there. On Tuesday, Hidalgo County Judge Richard Cortez released a statement saying that due to multiple reports of migrants being released by the federal government with COVID, he's calling on federal immigration officials to stop releasing them into the community. Judge Cortez is also calling on Governor Greg Abbott to restore the county's ability to implement safety measures. So this is a government-facilitated, government-implemented, government-directed COVID outbreak from the same people who claim to be so terrified of COVID that every last school child has to be masked despite a 0% statistical death rate among children from COVID in the U.S. Again, no matter what's going on with the vaccines or the testing or the breakthroughs, keep your eye on the ultimate goal here. You can see it in this article today by Forbes, headlined, Europe sees vaccine passport explosion for hotels, restaurants, museums, and more. They've already got their travel papers. And the way they're counting on doing it here is forcing, pushing, intimidating the private sector into requiring these passports till there's increasingly no place you could go without them. The goal is to get the vaccinated and the unvaccinated on a permanent tracking system. Will they succeed? Well, I think it's going to be harder than they think. It's going to be up, though, to state governors, particularly red state governors, to stop this. There'll be places they'll have trouble doing it, like with airlines, when you fly from state to state. But the fight over this is going to have to be at the state level. To free people from this, we're going to need laws banning the passports, or at a minimum, executive action. Will it come too late, or will they stop it? Pray they get this right.